Well, time now for a look at what happened in politics today. Alberta says it will opt out of the Liberal NDP pharmacare plan. Instead, it wants full compensation. Now, both Alberta and Quebec have said they plan to opt out, with Alberta's health minister stating her province already has its own programs, including some coverage for contraceptive and diabetes medication.
We already provide over 5,000 drugs through our robust pharmacare program here in Alberta, which include diabetes medication, which includes birth control medication. So we would be absolutely willing to enhance those programs. All we need is the federal government to provide those dollars to us, and we will make sure that we enhance the programs.
The federal health minister, Mark Holland, was asked about the prospect of provinces opting out earlier today. He says provinces should pause and wait for details before making a decision.
You know, for provinces to say whether or not they're going to participate in something or not when they don't even know what it is a little premature. We're going to meet the deadline. We're going to be tabling legislation this week, and that means that there's an opportunity to talk about what exactly this is. You know, it's unfortunate. I would have liked to have an opportunity to talk to my provincial and territorial counterparts. I'm going to be over the next coming days, you know, in advance of tabling legislation, so they can understand what our intention is.
The Euthanasia Prevention Coalition is urging senators to pass Bill C-62. That is the government's bill to delay the implementation of medical assistance in dying to those with mental illness as their only concern. Now, the group says it wants to see lawmakers amend Canada's MAID laws to prevent MAID for mental illness permanently. Garafalia Malusis is a lawyer who has struggled with depression. She decided to tell her story after the passage of Bill C-7 in March of 21.
Having reached this point, I find it deeply disturbing to see that our society is moving to a place where it would offer suicide assistance to those who really need suicide prevention. You know, I was someone who didn't have access and didn't want medical intervention by nature of my condition. And so I very easily could have accessed this. Many people have told me I wouldn't qualify, but I was an intelligent, conscientious, and motivated young person, and I have no question that if medical assistance in dying from mental illness had been available when I was in high school and university in those years that I struggled, that I would not be here today.
Federal public service unions want the government to cough up more settlement cash for damages related to the Phoenix pay system. The unions and the government did previously negotiate an agreement for damages covering the 2016 to 2020 period. But today is the 8th anniversary of the system's launch that left federal bureaucrats underpaid, overpaid, or not paid at all. The backlog of unresolved complaints still sitting at about 444,000.
Until federal public sector workers are paid properly and on time every single time, workers deserve additional Phoenix damages and an extension to the severe damages claims process until workers are made whole.
And finally, members of Parliament are debating a Conservative motion on the ArriveCan app. Opposition leader Pierre Poilievre wanting a full accounting of every dollar spent on the app.
We want the government to be obliged by this House to release all the documents, all the costs, tell the truth. We want to know everybody who got rich through this corruption and how much Canadians actually had to pay for it.
The Auditor General has said the total cost of the app could not be determined, and that's due to poor record keeping. She estimates the project cost nearly $60 million. The vote for the motion will take place Wednesday afternoon, though it will not be binding on the government.